What we're trying to do is get the best, most comprehensive understanding we can about the state of the transmission of this virus here in the state. And one other novel approach that's being looked at both here and in the United States and also in countries around the world is actually looking at wastewater. So when people are infected, oftentimes the virus will end up in wastewater, and you can analyze that water to determine how much it may be circulating in the community. And this has been used historically for viruses like hepatitis A or norovirus or even polio. And so there was interest in trying to use some of these methods early on during the COVID-19 outbreak in several European countries to see if they could detect outbreaks early. And so even though these methods are new and they're evolving and we're still having to do a lot of research, they did find, at least in a couple of European countries, that they could actually detect it in the wastewater before they detected it in people through a standard diagnostic test. And so with interest in this type of testing growing around the world, there have been a number of states that have undertaken this, and what we want to do here in Wisconsin is bring these methods, some of these very novel approaches to surveillance here to provide, again, yet another picture to all the other testing that we do to get the most comprehensive understanding of transmission. So the plan at this point is to really focus on the counties with the most people. So by focusing on just about 20 counties, we can probably assess somewhere around 3/4 of the population of the state. And by testing that wastewater on a very routine basis, maybe about every week or so, the goal is going to be able to look at the amount of virus in the water and determine, is transmission actually increasing? Is it decreasing? And does it match up with our testing from people? And that should provide yet another way to validate what we're seeing through our traditional testing. The other part of this project will be to test a much broader sample of wastewater systems across the state. These may be rural areas where there isn't much transmission, or at least we don't know about it, or there may not be much testing of people. And by testing those on a less frequent basis, we may get an idea of emerging hotspots or areas of transmission before we've had a chance to detect it through our more traditional ways. And in doing so, the goal is to be able to focus public health resources and focus our response more quickly to bring the disease under control as quickly as possible. So this, like the other project that Dr. Westergaard mentioned, this is an exciting collaborative project, not only with the Department of Health Services, but also with the Department of Natural Resources, and it's being spearheaded by the Wisconsin State Laboratory of Hygiene, who will be working very closely with a researcher at the University of Wisconsin in Milwaukee. So over the next few weeks, they will be continue to develop their methods for testing wastewater with a goal later on in the summer of doing much more routine testing. And at that point, we'll work on communicating these findings to the public in a way that's understandable and translatable, and then also providing it to our local public health partners so they can use it to inform activities in their jurisdiction.